My name is Rose Richardson, and I believe that the time is now to start working together for the benefit of the people, utilizing what nature has given us. Thank you.
First and foremost, we must focus on partnerships to gain inside perspective on what Indigenous health and wellness means to Indigenous peoples.
If you really want to do this, you have to be in a relationship. And the way you'll start being in a relationship is you meet a few elders. And they put me in touch with a few elders, and I went to their homes and visited with them. I went to a sweat lodge with them. I just spent the better part of a year building relationships. And then finally one of them said to me, "You're now ready to start doing this work."
When people want to make something happen, we can. And even though it's going to take steps, it's going to take trust building, it's going to take networking and developing networks, I think that these are all achievable by just first of all getting native and non-native systems to have a willingness to work together.
We call upon the Canadian Medical Association to work in collaboration with Indigenous healthcare organizations to create an Indigenous Advisory Council. Members of this Advisory Council will be present at all CMA policy meetings, especially those regarding Indigenous healthcare policies.
I can only do this work with the Indigenous community in partnership with them, which is, it's a humbling sort of position and realization to come to, because we get trained as physicians to think, well, you're now the expert in X, Y, or Z, whatever that is. And yes, I'm an expert, I'm a surgeon, but I'm not an expert in Indigenous life and Indigenous communities, Indigenous spirituality. That belongs to that community. And I can help, I can partner with them, and I think, move their agenda forward in terms of improving relationships between the healthcare system and Indigenous peoples, but I can't do it myself.
We suggest implementing a complementary approach that educates medical staff about the impacts of colonization, as well as incorporating Indigenous ways of knowing into our current healthcare system.
As a healthcare community, and this is bigger than physicians, we start to understand the issues around colonization and residential school experience and how that impacts our Indigenous patients as they interact with that healthcare system, and how we can do better as we do that. And that's going to be a one-on-one process, because I think as a consequence of those historical events, there's a challenge with trust and institutions. There's a whole cohort of existing practitioners that would benefit from learning these things as well. Treating people in the whole aspect of a person, including their relationships, their spiritual health, all of that is important, and allowing people the space to do that is very important.
We are referring here to a holistic perspective that incorporates physical, emotional, intellectual, and spiritual well-being.
In the holistic approach to health and healing, we understand that the Aboriginal worldview requires that we recognize the balance between the mental, physical, emotional, and spiritual aspects of everything.
We propose to bring in elders and healers from various Indigenous sources, such as the National Aboriginal Health Organization, in order to set a precedent for inclusion and acceptance of other Indigenous forms of treatment.
Eventually, I would like to see us working so close together that part of the hospital or areas are set aside for people that are going into treatment or are on palliative care, so that if they want to go traditional, that they go traditional.
We propose the acceptance of alternative forms of healthcare in conjunction with Western medicine, or as an alternative to Western medicine, if this is what the patient chooses.
People as well who've chosen to use alternative medicines, and they've felt that the doors to the cancer agency were shut to them.
There had been this a mayor who had lung cancer that was not deemed curable by traditional medicine, and he was offered palliative radiation and chemotherapy and wasn't interested in those modalities, and instead wanted to do traditional healing, and ran into some challenges with a clinician who didn't support that.
Once we voiced a concern, Corey Miller of the Cancer Agency responded positively and immediately, saying that he understood, he apologized for any communication problems around the refusal to monitor my condition.
And so the Cancer Agency contacted me and said, would I be willing to work with them and with this mayor to try and find out how to integrate traditional healing into the healthcare system, which is actually, if you look at the Truth and Reconciliation Calls to Action, it's Calls to Action number 22 is exactly that. It's almost word for word that. And so I jumped at that and said, absolutely, I would love to be able to facilitate that kind of dialogue. And so we're just at the beginning of how do we do that and what are all the issues, because it's not straightforward.
Nothing about us without us is our most important mantra to consider when exploring partnership between Indigenous and non-Indigenous groups.
You know, do they come and teach us all the pills and what's in them at any certain time? No, we are people, they expect us to trust them and to take what they give us. Now we're expecting the same in return.
Our calls for partnership, education, and action all require Indigenous representation to be present at the table.
And what do they expect? Me to turn around and teach them something that it took me all my life to learn since I was, a little kid.
How do we integrate these two or align them in some way that at the same time respects the traditional knowledge and the traditional healing? So, for me, as we go forward, I have no interest or investment in taking what they have, their traditional knowledge, but is there a way that we can find that their traditional knowledge can be accepted and fit alongside the traditional healthcare system so the two can walk in tandem, if you will? And that's going to take some time to sort that out, and that takes time and respect of protocol, respect of traditional knowledge. And
We propose a system in which medical professionals can track the usage of alternative methods of healthcare. This could be implemented during initial triage, where there could be a box that patients can check if they would like to have Indigenous-based medicine and practitioners available to them. In addition to offering a means to collect meaningful data, this would also encourage patient-led inclusion rather than leaving it to the medical professionals to determine when to involve alternative healthcare practices.
Through exploring paths to partnership, education, and action.
The CMA, along with their prospective partners, have the power to create significant changes to our healthcare system.
A system that is not currently meeting the needs of Indigenous people.
some of the work that I've done in our health region with health equity, I mean, people would say to me, I'm not racist. I treat the Indigenous patients the same way as I do the non-Indigenous patients. And then we'd look at our records and we'd say, but how come more Indigenous patients die of sepsis than non-Indigenous? Like, what's that all about? And then when you dig under the surface, it's not that people are saying you don't deserve to be treated, but this is more anecdotal than it is an experiential than I can say has been properly studied. But I mean, some Indigenous patients, if they go to emergency department, I remember when I went to emergency department, I was septic with something. They saw me. My wife brought me to there. She knows me well. She said, you know Dr. Groot. He's here. He's a bit confused. He's not responding like he normally does. They had me into triage and treated within minutes. And somebody else that's Indigenous could end up coming to the same wicket, and nobody knows to tell them to prompt the nurse properly. They don't get triaged initially as being septic. They got told to go sit in the waiting room, and they sit and they wait and they wait and they get sick. If you're a white person, you go and advocate for yourself, and you rattle the cage and you say, hey, I'm sick, come see me. And a lot of our Indigenous patients sit and they wait. And it's not that somebody's systematically saying, I'm going to ignore you. It's that we expect that they're going to behave in a certain way that they don't. And so we have to be sensitive to that. We have to find out ways to override those kind of systemic racisms, if you will. And they exist and we don't even know that we do it. So that the CMA can't do that. That's a thing that we have to do, and we have to constantly look to do better, and I think we can do better.
We know that by respecting, honoring, and celebrating Indigenous culture, and specifically its take on health and well-being, we, both Indigenous and non-Indigenous people alike, can better serve the health needs of both these communities.
This is about relationship. You don't quit. If you want us, we will be there with you if you want to be there with us, but you can't just do this for the sake of doing some research and you get your whatever you get in your academic centers and then you go away. He said, if you're going to work with us, you work with us, and we'll build a relationship.
How can a doctor of medical science explain traditional medicine? They can't. But if we learn how to walk side by side together, then maybe people will be able to make informed choices for the betterment of their own personal health.
All I'd like to say is the time is now that we start working together for the benefit of everyone.